Hi, I'm Dr. Merve Aksoy. I work in Health Sciences University, Faculty of Gülhane Dentistry, Department of Pediatric Dentistry. Today I'm going to share the survey study that we have together with Dr. Sultan İnce, who works in Afyonkarahisar. The name of the study is Evaluation of Toothbrushing Frequency of Children and Adults who applied to Afyonkarahisar Oral and Dental Health Center during the COVID-19 pandemic period, a survey study. As you all know, World Health Organization has announced COVID-19 as a pandemic in March 2020, and since the date, prophylactic measures that should be taken by individuals have been told by scientific and official authorities to the communities. Hand washing is in the first place for personal hygiene, but oral hygiene habits are as important as hand washing, since the oral cavity is the main entrance of microorganisms from the external environment through the internal system. The recent studies show that although the presence of other systemic illnesses and age are risk factors for mortality of COVID-19 disease, some other factors may be affectable on the prognosis. It's known that atypical pneumonia is mostly the reason for hospitalization. Bacterial infections secondary to viral infections seem to be the reason for pneumonia, and these bacteria are mostly the same that's isolated from the oral cavity. Hence, the improvement in oral hygiene habits is as important as hand washing. It's still unknown if the individuals are aware of these situations or not. Considering this information, we plan a survey questionnaire comprising toothbrushing habits of dental patients, and the main purpose of the study was to determine whether the toothbrushing habits of individuals who had referred to our clinics between the days 15 November to 30 November 2020 had changed during COVID-19 pandemic or not, comparing the period before pandemic. The survey study consisted of 7 questions, including demographic data and toothbrushing routines in the morning and at the night before pandemic and during this period. The survey study was held on 200 patients, 30 children and 170 adults who were admitted at Afyonkarahisar Oral Health Center since 15 to 30 November 2020. Those who are completely healthy as ASA standards and whose ages differ from 10 to 65 were taken into the study. Pregnancy was considered as an excluding criterion for female patients. The study protocol was conducted in line with the principles of Helsinki Declaration and with the approval of the Afyonkarahisar Health Sciences University Board of Clinical Ethics Committee. Informed consent was obtained from all participants or their legal representatives. The survey study consists of 7 questions, including demographic data and toothbrushing routines in the morning and at the night before the pandemic and during this period. The data obtained were analyzed with IBM SPSS 21 package program. While examining the relationships between groups of nominal variables, chi-square analysis was applied. While examining the differences within the group, the Wilcoxon test and the Friedman test were used in the comparisons made depending on their levels. When comparing more than 2 times, if a significant difference was found, with the help of post-hoc tests, which groups caused the difference was determined. 0.05 was used as a significance level while interpreting the results. It was stated that there is a significant difference when p is smaller than 0.05, and there is no significant difference if p is bigger than 0.05. Although there is no statistically significant difference between pre-pandemic and pandemic periods in terms of morning toothbrushing frequency in children, it was found that the frequency of brushing teeth in the morning before the pandemic was significantly lower in adults compared to the frequency of morning toothbrushing during the pandemic. In the group of pediatric patients, there is no statistically significant difference between the frequency of brushing teeth at night before and during the pandemic. In adults, it's seen that the frequency of brushing teeth at night before the pandemic is significantly lower than the frequency of brushing at night during the pandemic. There is no statistically significant difference between the frequency of morning and night toothbrushing before and during the pandemic in neither girls nor boys. From now on, gender is affectable. The frequency of brushing teeth in the morning before the pandemic in women is significantly lower than the frequency of brushing in morning during pandemic. In males, there is no statistically significant difference between the frequency of morning toothbrushing before and during the pandemic. There is a statistically significant difference between the frequency of brushing at night in men and women before and during the pandemic. In both groups, the frequency of brushing at night before the pandemic was significantly lower than the frequency of brushing at night during the pandemic. You can see here in table 3 differences between morning toothbrushing frequencies of children and adults at pre-pandemic and pandemic periods. In adult, as you can see, brushing routines, toothbrushing routines in the morning in female patient is significantly different between pre-pandemic and pandemic periods. You can see that p-values are smaller than 0.05, but in a group of male patients, you can see that there is no significant difference between the toothbrushing routines in the morning between pre-pandemic and pandemic periods. In children, in pediatric population, you can see there is no statistically significant difference between pre-pandemic and pandemic periods in the morning. In table 4, this time you can see the differences between night toothbrushing frequencies of children and adults at pre-pandemic and pandemic periods. In pediatric population, again, there is no statistically significant difference between pre-pandemic and pandemic periods at night toothbrushing. But in adult, both in female and male, this time before this, when we are considering the brushing routines in the morning, just in female group there was a statistically significant difference, but here both in female and male groups there is a statistically significant difference in toothbrushing habits at night between pre-pandemic and pandemic periods. You can see it here, the p-values are smaller than 0.05. In summary, an increasing was observed in brushing frequency in the morning and at night in adults. Although morning and night routine was affected on behalf of brushing habits for female patients, the morning routine seemed to be unaffected for male patients. Whether morning or night, brushing habits did not change in the group of pediatric patients. According to previous studies, oral hygiene habits of women are better than men, and the recent study conducted the same results. Brushing habits both in female and male groups seem to be affected favorably in the pandemic period, which is encouraging for the field of oral and dental health of the community. During the pandemic period, brushing habits in the morning seem to be improved in female group. Although an increasing was expected both in male and female groups, in the terms of brushing habits during pandemic, it was direct that morning brushing routines of male patients were not improved. It may be related with restrictions and home working situations of pandemic. It's known that children are not in the risk groups for COVID-19 pandemic, and they are at home since the first day of pandemic. homeschooling, online education, and lower risk associated to COVID-19 may be the reason of the unaffected brushing habits seen in the pediatric population of the recent study. But the study is needed to be extended, comprising more pediatric patients to obtain more reliable results related to the group of pediatric patients. In conclusion, considering the results of the recent study, increasing in toothbrushing habits among adult patients during COVID-19 pandemic is promising. Although the same improvement in pediatric population could not be seen in the recent study, it's expected to be seen in the future. It seems that future studies comprising higher population of pediatric patients should be held on behalf of pediatric population. I want to thank to all of you for listening to me, and thank to Dr. Margaret Kim for inviting me this organization. Hope to see you in the next organization, and hope you are all going to enjoy the next sessions, the next presentations. See you.